Hello, thank you for joining the South Carolina Department of Consumer Affairs for our Wednesday webinar. We're joined today with the Department on Aging. We have Crystal Strong, who is the State Health Insurance Program and Senior Medicare Patrol Program Director. She's going to be talking to us a little bit about Medicare Open Enrollment Period and just kind of some general things that you might need to know about it. We know a lot of people have asked us a lot of questions about this issue, and we brought our friends at the Department on Aging in to help us out and kind of answer some of your questions about this topic and help folks out with that. If this is your first time with us, we use the GoToWebinar platform, which you've probably already gotten a little bit familiar with, but you should see a little question mark box kind of on the right side of your screen, which should allow you to type in any questions that you may have, and we'll try to get to those at the end. And you should also see a little paperclip or file icon looking thing on the right side as well, and that will allow you to submit any or to download our documents that we have. So we have the slides for the presentation available for you to download. So we hope you'll download that, and we'll kind of let things get started here. I'll turn things over to Crystal. Thank you.
So good morning, everyone. My name is Crystal Strong, as Scott mentioned, and I'm with the South Carolina Department on Aging, and I service Medicare beneficiaries. I run the SHIP and SMP programs here at the Department on Aging. So today we're going to talk a little bit about Medicare Open Enrollment, as well as some general information about Medicare, and I'll take questions, as Scott said, at the end if anyone has any. All right. And so the first one is, what is SHIP? SHIP is the State Health Insurance Assistance Program. We are funded by the Administration for Community Living, which is a federal entity, to provide free, unbiased Medicare enrollment, information, and assistance to Medicare beneficiaries and their caregivers. The SHIP program in itself is in every state in our territory. So there is one of me in every place that you go. So where can you go to enroll in Medicare? The Centers for Medicare and Medicaid Services is who administers Medicare. You enroll by going to the Social Security Administration or the Railroad Retirement Board. Whichever you paid into is the entity where you go to actually apply. And this can actually be done with Social Security via the internet, so you can do it online, or you can go to an office, or you can simply call the toll-free national number or your local office. The Railroad Retirement System, you actually have to call that entity in order to enroll in Medicare. Slide. It wants to go, but not go. Hold on 1 second. My apologies. My first time using this. And trying to get it to go forward. Just gonna escape and go. My slides are not advancing. I apologize. There we go. All right. Who is Medicare for? Medicare is the health insurance for people age 65 or over, those under the age of 65 with certain disabilities. You have to go through the Social Security Administration to be deemed as disabled. You can also get Medicare if you have ALS, which is also known as Lou Gehrig's disease. And then if you have end-stage renal disease at any age, you can qualify for Medicare. But this is the only 4 criteria that will allow you to get Medicare. And just a side note, to get Medicare at the bottom, it says you must be a U.S. citizen or lawfully present in the U.S. and have been here for 5 continuous years to apply for Medicare. Now let's talk about some enrollment periods. Medicare can be really difficult, as I've heard. There are a lot of factors that determine when you can get in, when you can make changes, how you can make changes, and the time frame is really, really important, because if you miss some of those deadlines, unfortunately, you may be penalized when you try to get it. So there are enrollment periods that Medicare has. One is called the initial enrollment period. And then we have the general enrollment period. We also have the open enrollment period, which we are currently in now. And then there's a special election period as well. So I'm going to go through each one of these and tell you exactly how they work. Now, your initial enrollment period. This happens surrounding your 65th birthday. You can sign up for Medicare 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. And with that second bullet, note that a late enrollment penalty at 10% per year if you bypass that initial enrollment period. So what that simply means is if you do not enroll in Medicare when you are initially offered it, and this is just someone who simply is retired, not working, and their 65th birthday rolls around. If you don't enroll in Medicare when they first offer it to you and you don't have a special election period to pick it up later, then you could be possibly penalized 10% for every year that you should have enrolled in Medicare but did not. And that second bullet says that if you were assessed that penalty when you were under 65, say you were disabled and got Medicare but opted not to take it, then you were assessed a penalty. That penalty will be removed once you reach 65. However, if you are 65 and over and don't take it when you're first eligible, that penalty stays with you for life. And also note that COBRA is not considered creditable coverage, and it's not allowed to be used as a late enrollment exception. So we've had, or people get COBRA because they were working and then they became disabled prior to 65, applied for disability benefits, and received them. Well, you continue to use your COBRA benefits during that time. However, when that time frame is up and it's been 2 years, they now offer you Medicare. You need to accept it, because if you don't, again, that late enrollment penalty will be placed upon you if you don't enroll when you're first offered it. Now let's talk about some of the other enrollment periods. The general enrollment period. This happens every year, January through March. And coverage is on the first day of the following month after enrollment. So if you bypass your initial enrollment, that 7-month window, and you realize now you need to enroll in Medicare, specifically Part B is the part that you want, then you have the opportunity in January through March to enroll, and your Part B benefit will start the first day of the following month. And this is every year. But just bear in mind, after March 31st, you cannot enroll. And therefore, again, you may be subject to a penalty. And those penalties compound each other. So for every complete 12 months you do not take Part B when you are first offered it, then they will compound that 10% for every single month. Then we have open enrollment period. Open enrollment period is going on now. It started October 15th. It lasts through December 7th. This is yearly. Your coverage is effective on January 1. And we'll go into depth about what open enrollment entails shortly. Then you have the MA. MA refers to the Medicare Advantage open enrollment. That occurs yearly as well, at January through March 31st, and the coverage is on the first day of the following month after enrollment. And I'll go into details about what that looks like as well. You also have a special enrollment. This is where you had creditable coverage or you moved in or out of your service area. There may have been some fraud notated and we can prove it. Or you have company or organizational insurance. So that would be you were working, you turned 65 while you were still working, and you opted out of Part B at that time because you were working. When you stop working, you have that special enrollment period to take Part B without any penalties. And it is specific. You have 8 months after your insurance stops or you stop working to pick that up without penalties. Anything beyond that, again, you may be subject to late enrollment penalties. Now, Part A. Everybody wants to know how many parts. There are currently 4 parts to Medicare. Part A covers your inpatient hospital. And that would be if you were hospitalized and you stayed in the hospital for at least 3 days, 3 nights, and then you had the day of discharge. Part A covers that benefit. You also have skilled nursing facilities. This is a rehab facility, not a long-term nursing home. This is where you go in, you went into the hospital, now you are needing some rehab services. You will go into a skilled nursing facility. You have to have had that 3-day stay as an inpatient in order to go into the skilled nursing facility. Then we have home health and we also have hospice. Both of those entities are paid at 100% under the Medicare Part A benefit. Home health, there are no maximum number of days that you can receive as long as it's medically necessary and the doctor has prescribed it and you get intermittent checkups, I think it's 60 days in between those visits, then you can continue the home health for as long as you need it. You have to be homebound, though, in order to receive home health. And the definition of homebound with Medicare is it takes a taxing effort for you to get out of your home. Then we know we have hospice. And hospice, you have to have that terminal diagnosis in order to receive hospice benefits. As long as you've been deemed terminal or have that terminal diagnosis, you can be on hospice for as long as you would like. Even if the diagnosis is 6 months and after 8 months, a year, you're still here and want to remain on hospice, you can, or you can simply go back to traditional Medicare. The choice is up to the beneficiary. Then we have Part B. Part B, it covers all of the other things that Part A does not. This is the main component that most people will utilize. They cover your doctor services, durable medical equipment, that's like a wheelchair walker, ambulance services, lab tests, preventative services, outpatient mental health. And people always ask the question, do I need Part B? And most of the time the answer is yes, because if you don't have Part B and you have Medicare as your primary carrier, then you're not going to get any of these services should you not take Part B. So you wouldn't be able to see a doctor. You're not going to be able to get a wheelchair or walker if you need it because you don't have that benefit that covers you for Part B. And currently Part B does cost. It is $174.70. We have not gotten what it will be for 2025. That information is not made public just yet, but they anticipate a slight increase. But until we get that information, we can't post anything. But right now, that benefit, as I mentioned, is $174.70, and it comes directly out of your Social Security check if you are receiving one. Okay. And I mentioned on Part B that it does cost. Part A generally is premium free. as long as you have enough quarters worked into the Social Security system or the railroad retirement system that allows you to get it free. It's 40 quarters, which is equivalent to 10 years. And either one of those entities can tell you whether or not you'll be able to get premium free Part A. Also, I don't want you to forget, while Part B, covers those doctor services, outpatient services, they also cover the vaccines that you need. So the COVID vaccine and boosters, your flu shots, your pneumococcal shot, your hepatitis B shot, tetanus shots, and other vaccines. They do cover that under Part B, as in boy. And a lot of people want to know about that shingle shot. To get the shingle shot, you have to have a Part D, the prescription drug component, to pay for a shingle shot. Okay? Now, the other entity of Medicare is the Part C, otherwise known as Medicare Advantage plans. There are a ton of commercials out there now about Advantage plans, and they work for some, but they don't work for all. These are plans that are contracted by the federal government, CMS, as we mentioned, to provide payment for Medicare services. So those entities that you see and all those companies you see on commercials in the back of your Medicare and You handbook, if you join a Medicare Advantage plan, the company or that you are joining is the one who is going to be providing your services for you. It is not traditional Medicare, your red, white, and blue card. It is going to be that company that you decide to join. Here in South Carolina for 2025, there are a lot of Medicare Advantage plans that are zero premium. They range from $0 to $92 for 2025. And they do offer, as it states on the slide, some additional benefits. They have set copays and deductibles, so you still do have out-of-pocket cost. They may offer additional benefits, and that's where they draw you in: the vision, the dental, the hearing. And those are added benefits that Medicare does not pay for, but some of these Advantage plans may offer them. A lot of them have limited amounts that they will pay, and they vary depending on which company you go with, which plan you select, and also your covered area. One of the things that we caution people, especially now during open enrollment, if this is something that you would like to join, make sure that you check with your providers before joining one of these products. Because although they may take traditional Medicare, they may not take an Advantage plan. And we would not want you to get into an Advantage plan and not be able to see the providers and go to the hospitals that you're used to using. Now, we're talking about Medicare Part D, the Medicare Prescription Drug Plan. It is an optional benefit. So, do you have to take it? The answer is no. Is it suggested you take it? Probably yes, because if you don't take it, again, just with Part B, you may be penalized down the road when you decide to pick it up later. It's not a big, hefty penalty. It's only 1% of the national average for a plan, for per month that you do not have it. But you can only enroll in at certain times, and now would be the time during open enrollment. So they too are run by private companies that contract with Medicare, and you can get them as a standalone plan with Original Medicare, known as a PDP. You can also join a Medicare Advantage plan, Part C, that has drug coverage incorporated with it as well. And with that being said, and getting the Part D, as I mentioned, it's optional, but just know that if you have prescriptions down the road and you don't have a Part D, you may not always have an opportunity or a special enrollment to get into one of these plans. Now, when can I enroll? Especially in a Part D. Of course, during your 7-month initial enrollment period, as we discussed first. Those are the months surrounding your 65th birthday. Then during open enrollment, which is now October 15th through December 7th of each year, with coverage beginning on January 1. It also mentions if you get Part B for the first time during general enrollment, you can enroll in a Part D plan at the same time. So as I mentioned before, if you decided or a person decided that they did not want Part B at the time, did not fully understand the reason that they actually needed it, and so they bypassed that initial enrollment, and now they're enrolling in that general enrollment period, they can take out the Part B as in boy and also D as in drugs. So they can get those at the same time. And they both will start on the 1st of the next month after they enroll. Now, other times that say you may be able to join is like if you're in an Advantage plan. They also have a Medicare Advantage Open Enrollment Period, which is from January through March 31st of every year. The only difference with that Advantage plan period, it won't allow you to join one if you don't already have one. So you have to have already been in an Advantage plan, excuse me, and want to be able to switch. So you can switch from Advantage plan to Advantage plan or back to traditional Medicare during that Medicare Advantage OEP. And so if you join one now, it starts January 1 and you used it, you don't particularly care for it, and you want to try another one, you can do that during that time, January through March, and it will take effect on the 1st of the following month. It says if you're new to Medicare, enrolled in an Advantage plan during your initial enrollment period, you can make a change within the first 3 months you have Medicare. So you turn 65, you decided to get a Advantage plan during that time, and you used it. It's not really working for you. You want to change, you can change back and go to a prescription drug plan as well. Special enrollment periods, we mentioned if you qualified, that would be if you stopped working, you moved from another state, gives you an option to enroll. You moved in the same state, but to a different address. And you have it's out of your current service area to another part of the state, you can enroll in that time as well. And then if there's a 5-star plan that is available, you do have a special enrollment period. Unfortunately, in South Carolina, we do not currently have any 5-star plans, so that would not be an option for us right now. All right. How can I get a plan or how do I enroll? You can compare plans by your computer or phone, and this is where the SHIP program comes in. We actually can do one-on-one counseling with you. That is what we are here for, to help you narrow down your choices. Yes, you can plug those things in on the computer, but if you don't really know how to read them, it can be a little bit difficult. So we are here to assist you. But you can go on Medicare.gov and compare plans. You can call the 1-800-Medicare, and as I mentioned, contact your local SHIP. I am here in Columbia. However, our state, for our aging purposes, is broken down into 10 regions. And in every region, I do have a coordinator that will be able to assist you in making plan choices, either via face-to-face visit or via the phone and computer. To join, you just simply enroll on Medicare.gov. That's what we use. You can call 1-800-Medicare. You can go to that plan's website if you choose. They say complete a paper enrollment form, but in order to do that, you're going to have to call the plan themselves and get a paper form. And as we know, most things are done by a computer. And then the plan will notify you whether it has been accepted or denied your application. During open enrollment, when you're making that change, generally there are no denials for the prescription drug plan. This is your opportunity to get into a prescription drug plan and or Medicare Advantage product if you choose to do so. Some things to consider. If you have creditable drug coverage, you probably do not need a Part D prescription drug plan. If you already have something with, let's say you retired from the state and you have the state health plan, PBUP, Blue Cross and Blue Shield services, you don't need a Part D prescription drug plan. It won't give you any more benefit than you already have, and it may cost you more. The creditable drug coverage, every year people normally get a letter that says that it is as good as or better than what Medicare has to offer. We also see persons who have VA benefits. And you have prescription drug plan. With them, you don't necessarily need this. TRICARE. So take a look at whether or not you already have creditable drug coverage and then compare it with a Part D. More than likely, you do not need a Part D plan. You would want to, if you don't have creditable drug coverage, you want to get the prescription drug plan. It says if you go more than 63 days in a row without creditable coverage, then you could potentially be penalized as well. So that would be someone who stopped working, they retired, they are not eligible for the health component of their retiree plan. And now they need to go to Medicare and get a prescription drug plan. Well, don't go 63 days without one. You want to make sure that you get it as soon as that drug coverage ends so that you are not penalized for it. I already mentioned open enrollment period, and that's where we are now. You have until December 7th. Now, they did say in some of the meetings that I had, because we are declared or were declared as a natural disaster area, FEMA declared us as well as the state, you may be able to get an extension. However, it was only told, it is not written. And if you are requiring an extension, you're going to have to go through Medicare.gov, and they do it on a case-by-case basis. But because open enrollment is still going on, and it probably won't impact you because it ends December 7th, I suggest you get it in as soon as possible. And this is the time I told you you can enroll, disenroll, switch Medicare Advantage plans, drug plans. You can do all of that during this time frame. And even if you don't think that you want to switch, it is a good idea to still check the plan that you're currently in. These companies make changes to their formularies, and you may have gotten something in the mail you didn't necessarily read, and you don't want to get to the pharmacy in January and not be able to get the medications that you need. This is what I mentioned earlier, the Medicare Advantage OEP. It happens in January through March, and this will allow you to make changes. So if you got into one during the regular open enrollment, and it was not working for you, you did not like it, you have the opportunity to make a change. As it states on the bottom, you can't switch from regular Medicare to an Advantage plan during this time. You have to already be in an Advantage plan. You can't join a prescription drug plan during this time. This time is when you do it, October 15th through December 7th. And you can't switch from a drug plan to another one. The only thing you can do during this time, during the Medicare Advantage, is go from one Advantage to another, or come out of the Advantage and go back to traditional Medicare and a prescription drug plan. All right. So they also have some resources to help beneficiaries offset some cost as well. For the Medicare Savings Program, this helps pay the Medicare Part B premiums, deductibles, co-insurances. They have what we call extra help to help pay for Part D cost if you're eligible. And then Medicaid, which is part here in the state, is under the Medicare Savings Program. So you would be applying through the South Carolina Department of Health and Human Services. And the next slides just have the income limits. So if you think you are eligible and or you know someone that may be eligible for it, then by all means give us a call and we can do applications or assist the persons in getting applications done for them. Okay. And the limits, now you may not be eligible for 2024, you may be eligible in 2025. Those limits go up, and on March the 1st, we should know what the new limits would be. Okay. And so these are just the same things as I mentioned, the Medicare Savings Program under the Medicaid system here. They also, I want to say, with the Part D prescription benefit, they expanded the low income subsidy, that's that extra help, to help pay for persons to get their medication paid for. In addition to that, there is another benefit that will happen in 2025. I know persons know about the donut hole that was built into the prescription drug plan. Well, that donut hole is technically going away in 2025. The maximum amount beneficiaries will be paying for their prescription drugs is $2,000. But if you qualify for extra help, that can help offset the cost. And that's what this slide is about to tell you. There's no deductible, no premium. Everybody is on the same level when they apply. They've gotten rid of the partial programs. Everybody gets the same benefit if you are eligible for the extra help or what they call the low income subsidy. That's what this slide is as well. Just gives you some general information about it and what your copays would be should you qualify for extra help. Now, I just want to briefly talk about the Senior Medicare Patrol Program. That is the fraud arm of what we do. We empower and assist Medicare beneficiaries, their families, caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach. We go do outreach events, counseling, and education. We have a lot of people, unfortunately, that do not report what happens or could potentially or happen to them because of guilt, shame, perhaps. But if you suspect anything, please give us a call. These are some of the things that we want to know. If you got a call that you weren't sure about, we take anything. Just report it. We want you to be diligent in looking at your Medicare summary notices for any errors that may be there. And if you think it is, please give us a call and let us help you sort that out. So during especially this open enrollment period, a lot of people will probably be getting calls. We want you to report potential Medicare scams. If someone calls you claiming you're going to get a new plastic card, that is not true. New cards for Medicare went out several years ago that removed your Social Security number and replaced it with a de-identifying number. If you notice, it's a series of numbers and letters. There's no hard plastic card coming. There's no black card coming. No new card is coming to you. So if someone calls and says that, please hang up. Don't engage them in conversation, because unfortunately what they do is want to hear that word yes that you say, and they take that yes and cut it and paste it into where they want in the conversation. And then unfortunately you'll be getting items in the mail that you didn't even request. Okay. So although it's a new year, no new cards, you get the same card. It can be replaced. You can actually laminate the one that you have, but just know that you're not getting a new card. Nothing is coming to you. And we also try to make people aware that Medicare does not call you unless you called and left a number, initiated that contact for them to call you back. Same goes with Social Security. Those federal entities usually do not call you unless you initiated the call and ask for a return call. All right. And also that last bullet, I'd like to highlight, when they say they need you to verify your Medicare number, please don't give them your number. Don't give them your doctor's office. None of that information. If they need to verify they would already have your number. So don't give them the first three, none of that. Okay. And then one other thing, especially during this time, we see a lot of is Medicare marketing violations or misleading marketing. If someone calls you and say they're from Medicare, Social Security, Medicaid, just as I mentioned, they would leave a message, and if you're not sure, don't answer the phone. Let them leave a message, because if they are actually who they said they are, they will leave you a message and a phone number where you can reach them directly. If they offer you a gift, if you agree to sign up for their plan, be leery of that. They send you text messages or calls without your permission. If they pressure you to enroll in their plan, or they approach you in public and tries to sell you a plan, be very, very wary of those and report those violations. If they want to sell you a product and you already have something that is already as good as Medicare or better, such as a supplemental insurance policy, you already have that, and someone is trying to sell you a Medicare Advantage plan, be leery of those. Yes, it's a zero cost, but that might not be the best route for you to take. And if you are unsure, please, please, please give our office a call and ask for the SHIP person within your area. And if you notice any marketing violations at all, we ask that you call. We even have you can email it to us if you'd rather not call and say what it is, so that we can put that information out. We would like to highlight what's going on in our state, but also get information from other states as well. And I believe that this concludes my presentation. So I have my contact information up on the screen. The toll-free number reaches our reception area. And then if you'd like to talk to me one-on-one, that is my direct phone number as well as my email address. So if there are any questions that anybody has right now?
Yes, we did get a few questions, Crystal. I'll
Okay,
read some of those out for us here. I
all
have
right.
one. We always get questions from people where they're getting those phone calls and stuff from people,
Mhm.
about their Medicare plans and all of that. Are there any scenarios where somebody might actually be getting a new Medicare number like that? I know that's one of the calls that people say they often get is, they're told that they're going to get a new number, so they have to, provide some kind of information like that. But
If you request one, am I muted?
no, you're
Okay, good. I wasn't sure if I hit the wrong. If you request one, say your number was compromised and there was some fraud going on, the first thing you want to do is contact 1-800-Medicare, and they can put in the system and put in a request for a new number, but only if you requested it. Medicare is not going to just generally send you a new number. But there are possibilities and there are situations where people can request a new one.
We had one question on, and I think this is why you were talking about Part B, but they were asking why is the shingles vaccine not covered like other vaccines and that.
I'm going to be honest with you, I don't know. I never had anybody ask me that. That would be something I'd have to research. It's you know what? I
I
don't know.
imagine all that's kind of
I'll look. I can look it
determined by
up.
the
Yeah,
federal
and
government.
I want to say yeah, it is their rule, but I want to say it's not considered medically necessary. And I say that because more than likely, if you've never had chickenpox, you most of the time are not going to get shingles either. So it's not considered a medically necessary vaccine. And they just started covering it a few years ago. But I can
Um,
get the actual terminology from CMS.
We had somebody else ask kind of what is a 5-star plan?
A 5-star plan is a plan that's rated by CMS or Medicare based on their requirements. So we have a lot of plans in our state are 4s and 4.5s. If you log on to Medicare's website, you can click on one of those plans with it. It will tell you all the criteria that they use to rate them.
All right, I've got another. We have somebody who says, I will be 65 in February of 2025. I still work and plan to work for another 4 years. I have health insurance on the job and TRICARE military. Is there anything I need to do now?
No. Well, yeah, you don't have to join Part B as long as you're working, but they do suggest you at least sign up for Part A. That can be done on socialsecurity.gov with a mysocialsecurity.gov account. You could simply go on there, click the button, you want Part A only benefits. It may or may not pay, although because you have your current employer, you have TRICARE, but there's a possibility. And of course, if it's premium free, you just want to go ahead and sign up for it. It's not mandatory, but they suggest that you do it. Part B is in boy, you can delay until you stop working. Because when you stop working, and I don't know if you know, TRICARE mandates that you take Part B in order for it to work as TRICARE for life. So while you're working, you're fine, but when it stops, then you're going to want to take that out.
All right, we had somebody ask, sorry, my screen's kind of jumping around here on me.
Mm-hmm.
Can you explain Medicare Part F?
Medicare does not have a Part F. You're referring to a Medicare supplemental or a Medigap plan. That is a Plan F. And a Plan F or a Medicare supplement is insurance that you purchase from individual insurance companies to supplement the Medicare benefits for Part A and Part B. So once Medicare A pays or B pays, they pick up the co-insurances, the deductibles associated with it, and pays that 20% on the back end for Part B.
And we have somebody who asked about Part D prescription benefit. Is that issued monthly?
No, once you sign up for it, it is for a year. So if you're signing up now, it will go into effect January 1, and it will be good from January 1 through December 31st of the following year.
All right. I'm trying to go through here, see what we've maybe missed. And I know we've got a few things in here. And I think some of these we may just have to reply to the person possibly.
Okay.
But I do want to see if I can share my screen here, if possible, as we kind of wrap up. Let's see if I can get mine. Hopefully you'll see my screen, and we do want to just kind of remind folks not to give that personal financial information or any of your medical information. Well, when you're getting all those random calls that you can't verify and things like that. And it is kind of worth telling people, if you think you're a scam victim or identity theft victim with any of these types of things, you can contact our office, the South Carolina Department of Consumer Affairs. We have an identity theft unit who can kind of help walk you through that process. And, obviously, if it's something involving Medicare specifically, we probably want you to get in touch with the Department on Aging as well, and kind of let those folks handle that as well. But we can kind of help you out with any of those identity theft type situations that you might have that you're dealing with. And we want to let you know that you can get our publications, including our Scam Prevention Guide, Ditch the Pitch, from our website, consumer.sc.gov. We'll encourage you to follow our social media accounts as well. We have a lot of our webinars and things on YouTube, so that might be something that you want to take a look at sometime if you've missed some of our presentations. And kind of the big thing that I want to remind folks is that we're still doing a few more shred events. Our last one that we've got scheduled for the moment is going to be in December, and that will be here at our office on Greystone Boulevard in Columbia. And that one will be raising donations for Harvest Hope Food Banks. So we'll hope that you folks in the Columbia area can join us on December 2nd for that. And I'm kind of wrapping up here, and it looks like questions have kind of slowed down, but we'll try to pass along any of these to Crystal as well as they've come in. And of course, if you get our emails, you can reply to those, and those will come in directly to me, but you can also email me or call me, and we'll try to get those answers directed for you. And just kind of want to wrap things up for us and thank Crystal for taking part in our presentation today. And Crystal, if there's anything you want to say to wrap it up, any one piece of advice for folks or anything like that, please feel free.
When in doubt, please give our office a call and get in touch with your local SHIP person. We want to make sure that and ensure that you get all the benefits that you need, especially for the upcoming year.
All right, well, thank you very much. And we do have one question here that I think might be something kind of worth addressing real quick. Somebody's asked if there's a supplemental plan, reliable kind of rating site, like website that they can go to kind of get some of that information. Or
we have some general information about the companies and the plans, but if you want more specific, detailed information, the South Carolina Department of Insurance is the one that rates these plans, so you would need to go to them.
Excellent. Well, thank you very much, Crystal, and we thank everybody who joined us today, and we hope you'll join us again for another webinar, and we'll see you next time. Thank you very much.
Thank you.